All right, welcome class. I'm Colleen Ignacio, your instructor, and I am retired military veteran, a mother to a 11, almost 11-year-old unicorn princess that is homeschooled. So she may be in class sometimes with us. And I am really excited for you all because you're the future of healthcare. I will read the little tidbits in the chat because some of the students cannot speak. Their microphone may not be working. So we see Sophia. She is on the softball team and she is from New York. Khadija is here and she chose this course because she likes to help others and she's from Norfolk, Virginia. And Amaya, can you do a quick introduction for Manuel, please?
Hi, I'm Amaya.
Okay, she was quick. All right, Samia.
It's Samaya, but
Okay,
um, I am Samaya. I am in the Army Reserves, and I have an almost 2-year-old son.
okay, thank you, Samaya. Okay, very good. All right, Amani, welcome. Quick introduction for Manuel.
I'm Amani.
Okay, so she was super quick. Okay, thank you, Amani. And then Emily.
I'm Emily. I play softball here at Bryan and Stratton.
Okay, fantastic. I think now Manuel, it's your turn.
Hi, I'm Manuel, and I run track here at Bryant and Sheridan.
Oh, okay, so you're a track star. So do you know Amani?
Yes, we're teammates.
All right. Okay, we got a class full of athletes. Maybe before class, I should let you all like stretch us out and warm us up. Like that might be really good. Okay, I can use that in my life. Okay, excellent. Manuel, are you from this area, Hampton Roads?
No, I was born and raised in Maryland, Upper Marlboro, Maryland.
Okay, all right, fantastic. Okay, welcome to this class. And let me ask you this, do you have access to Blackboard?
Yes, I do.
Okay, excellent. So you can get started on your assignments. Okay, so we are looking at, and what last week you missed, let me just share my screen here. Last week, we started lecturing on module 1, week 1. So can you log in? I just want to make sure that you have these notes in front of you, Manuel. And if you're wondering how to get to these notes, I'm just going to show you real quick. When you're on Blackboard, you go under modules and slow me down or just say stop if you need me to stop. Amani said you can't open the notes. Okay, so go to the class and go under modules. I'm going to make this a little bit bigger. Okay, so you should go to the class and then go to modules. Now, you should not be in the lab because there may be 2 classes that show up for you. You're not in the lab section of the class because let me just go back. So for this one, it says clinical procedures lab. There's really nothing there. I don't use that Blackboard shell. Go to where it says clinical procedures without the word lab there. That might be the problem, Amani. So then you'll click on this and then you'll be welcome to the class. So let me just make sure. Amani, can you see this now? Okay, yes. Okay, good. All right, so now we'll click under modules. And this is where you should be able to access the ebook. And you should see module 1. And actually, you should see all of the 8 modules. I like to open them in the beginning just because sometimes students like to work ahead. Especially if they're athletes. I had one time a student was expecting, so she wanted to finish all her work before her baby was due. So I was totally okay with that. So under modules, you should click module 1. That's what we're going to highlight today. And under this, you'll see Alt 130 Module 1 Lecture. Those are the notes. So you click that and a Word document will appear, and that's the Word document that I had been using. So I'm going to pause for a moment to make sure everybody's able to get these notes and see these notes. Okay, and while you're getting them, the new students, I do hand out hard copies of these notes, and so I will have weeks 2 and 3 for you next class. So I'm just going to pause for a moment to make sure everybody has these notes. Does anybody not have these notes? Speak up, please. Okay, Amani, are you able to see the notes now? And Manuel, I'm going to ask you also if you're able to see the notes.
Yes, I can.
Okay, excellent. Very good. Amani? Okay, yes, she says yes. Okay, perfect. All right, excellent. The reason why I want to make sure that you have these notes is because we're going to have a game of Kahoot, and I will have prizes next time for whoever comes in the top 3 for this Kahoot, and we will have a quiz on this after the Kahoot. So I want to make sure that you have your notes with you because I will allow you to use your notes for the quiz, okay, since it's our first quiz. All right, so we were talking about the chain of infection before Emmanuel came. And so the chain of infection or the cycle of infection is what we talk about when we talk about infections or pathogens. And pathogens are disease-causing organisms that seek to make us sick. The 5 parts of this cycle or chain of infection are the reservoir host, the means of exit, means of transmission, means of entrance, and the susceptible host. So we started out, and they already told us the reservoir host, Sophia told us so nicely, that is someone who has an infection and is able to carry that infection to someone else. Okay, and then I think Emily was the one telling us about the means of exit. How does it get out? She mentioned the person coughing or sneezing, right? That's how their bodily fluids. That's how that pathogen will get out of the person. Now, the means of transmission, was it Amaya or Samaya that was supposed to tell us about the means of transmission? I think it was Amaya. Okay. Amaya, do you want to tell us about the means? Okay. Oh, it was Samaya. Okay. Samaya said means of transmission is how the infection spreads from person to, okay, to another. Okay, very good. So that is correct. Okay. So how it is spread. So it could be spread via contact. It could be spread via droplets, airborne. It could be spread by a vector. That vector, for example, could be a mosquito or a tick. Let's go to, okay, since Samaya did that one, we'll go, Amaya, what is the means of entrance? And the susceptible host, I'm going to go to Amani to tell us what the susceptible host is. So Amaya is going to tell us the means of entrance. She could unmute or she could put it in the chat. And then Amani is going to tell us about the susceptible host. And it's totally okay if you look at your notes, you read it off your notes. That's totally fine. Okay, so Amaya, very good. So the means of entrance. So when someone consumes the infected liquid, yes. How does that pathogen get inside our body? In this case, she is consuming, right, that water that that individual coughed, sneezed over, but it could also be entering if she had a break in her skin and she touched blood, right? Because we know about blood-borne pathogens, pathogens that live inside blood or bodily fluids. Examples of those bloodborne pathogens could be HIV, hepatitis, right? So very good, Amaya. Okay, Amani, tell us about the susceptible host, please.
Is a recipient of the infection.
Yes, nicely said. I like that. So they receive this, unfortunately, right? This pathogen. So very good. Okay, so the pathogen invades the reservoir host. Okay, and the reservoir host could be a human, it could be an animal, right? In our case, we're really focused on humans. We could have a human that is a carrier. Who remembers what a carrier is?
Isn't it a person who doesn't get like the symptoms or know that they have the affection?
Okay, nicely said, Khadija. That's right. So a carrier, they have the pathogen, they're infected, but they don't realize it because they're asymptomatic, and then they're going to pass it on to the next person, right? Or maybe a group of people, right? If we don't do our job as healthcare professionals by keeping our area clean and sanitized and neat, okay? Very good. All right, a couple terms that you need to know for the quiz and for the test and for general knowledge is endogenous infection and exogenous infections. Okay, so this reads in an endogenous infection, an abnormality or malfunction in routine body processes causes normally beneficial or harmless microorganisms to become pathogenic. So the example that we use in class is all of us have E. coli in our intestines, in our guts. So if we go to the bathroom and we eliminate waste, fecal matter, stool, right? There's E. coli that lives in that stool. So if we don't wash our hands, oh, I used the UTI. Sorry, that was my second option. So if we are female and we wipe from back to front, we are now introducing that E. coli to our urinary meatus, thus causing a urinary tract infection. Now, that E. coli didn't cause us any issues when it was in the intestines where it's supposed to be, but if we have improper hygiene practices, we end up with a UTI. Another way we can get this beneficial or harmless bacteria is if we go, we eliminate our stools, we wipe, and we don't wash our hands, and then we go prepare our lunch, right? And we eat our lunch. So that is a way that we can have an endogenous infection. Exogenous infection, the pathogen occurs from outside of the body. Okay, so maybe on a dirty table, dirty equipment that hasn't been sanitized. Now, if the patient gets an infection from the hospital or healthcare setting, there's an important word that I want you to be familiar with, and that's nosocomial infection. That is a hospital-acquired infection. Okay, and our job as healthcare professionals, me as a nurse, you as medical assistants, is to prevent our patients the best that we can from getting these nosocomial or exogenous infections. So that means that we must wash our hands. We must use alcohol-based sanitizer. We must wipe down tables and keep everything neat and clean, right? That's going to be our job. It's incumbent upon us to do our best to make sure that our patient doesn't get these exogenous infections. Any questions so far? All right, so for some of you, this could be a review, but we do have a couple new students, so that's why I'm taking the time to kind of go over this, okay? All right, so, and you're probably wondering how long we're gonna have class. In the classroom setting, I think it says that our class goes until 9. I'm not gonna hold you here on Zoom until 9. When we are in the classroom, we'll probably go until maybe 8:30. We won't take the full time until 9, but this is a big group though. So if we are getting behind, that will keep us till 9, but I think the latest will probably be in person is 8:30. I'm gonna try to get ahead so we don't have to worry about staying till 9. And if everything is going smoothly, I'll probably release you all at 8 o'clock. So let's see. But today, we started at 5. We'll take a break. We'll probably be finished by 7:30, hopefully with everything that I want. But we will take a break at 5:50. Okay. All right. In case you were wondering. All right. And we will take a quiz probably at the end of this module right here, just to make sure everybody's good to go. All right, so let's go back. So the pathogen exits the reservoir host by the nose, the mouth, the eyes, any orifice that we have. It's through feces, through urine, through vaginal fluid, seminal fluid, any other fluid, through breast milk, through blood products, open wounds, right? So that's how the pathogen can exit the infected person. Okay, so let's talk about transmission. There's direct transmission and indirect transmission. So direct transmission, it moves directly from one host to the next. Okay, now indirect transmission, this is how we have it that it's capable of existing independently, right? This pathogen. And the example that we used in class last time was, for example, tuberculosis. If a person with tuberculosis is in the elevator, they're coughing, they're coughing, they're coughing, they're letting out all of their vapors, it's going to linger in the air because it is a type of airborne transmission, just like influenza, just like COVID. It's kind of indirect, right? Because it's not the person directly coughing in the face of the other person. That would be a direct transmission, okay? Now, we talked a little bit about the airborne transmission. The tuberculosis was the example that was used. Bloodborne transmission is anything that, any pathogen that lives inside of blood or blood products. That's why we have to wear our PPE, our personal protective equipment, okay? PPE is your personal protective equipment. That's really important for you to wear. And I do have a video I'll probably show after the quiz on how to properly don is to put on and doff is to take off. Okay, so if someone says don your PPE, that means to put it on, and then doff means to take it off. Okay. So airborne transmission, particles through the air, bloodborne transmission through blood, broken skin. So if we see a puddle of blood, it's not going to be a good idea to not have gloves on, okay? We think about a woman that is pregnant. She can transmit anything that she has that's bloodborne, right, if she's infected, to the fetus, okay? Foodborne transmission is through food. So food poisoning, getting that diarrhea from food that has been contaminated. Vector-borne transmission is through a vector, usually your insects, your mosquitoes, your ticks can be examples of vectors. Transmission through touching. So touching a person's mucous membranes, don't do it without gloves, right? As in the case with sexually transmitted infections. And we can have indirect transmission through touching things that are dirty or contaminated. And those things are called fomites. Okay, that's another fancy word that you need to know, fomites. Okay, so a drinking glass, a doorknob, a pen, shopping handles, pencils, those are all considered potential fomites. Okay, so the pathogens, they can enter the host through any of the mucous membranes. And if there's a break in the skin, remember, the skin is the first line of defense against injury and infection. If the skin is broken, then wow, these pathogens have a way to get in. Okay, so things to think about that can affect a person's susceptibility, them becoming a susceptible host, is the age. The very young and the very old are at high risk. Okay, some people have a genetic predisposition to certain illnesses. Okay, and then nutritional status. If a patient has poor nutritional status, they're at increased risk. Their immune system is decreased. And remember, the immune system is designed to help us fight off these pathogens. If there's other diseases in the patient, then they're at risk. If a patient is under high stress, they're at risk. If the patient has poor hygiene habits, they're at risk. Now, we never want to be judgmental of our patients because a patient may have poor hygiene habits because they're homeless. Maybe they were not taught how to properly wipe from front to back if they're a female. Maybe they were not taught to do these things. And I will tell you, it doesn't have anything to do about socioeconomic status. because there's a lot of discussion in the past maybe year or so about celebrities that say that they don't bathe on a regular basis. They only bathe when they see themselves being soiled, right? And they're like, whoa, what's going on, right? So again, hygiene habits that could be based also on religious preferences. So we have to keep that in mind. And again, we're always non-judgmental. And a person's general health will also contribute to them becoming or potentially becoming a susceptible host. All right, I'm going to pause for a second because there's a lot of new words, especially if you hadn't seen this before. Does anybody have any questions? Okay. All right, factors related to and if you have any questions, please put it in the chat. I'm glancing over the chat periodically. It's totally fine to ask questions. Okay, so factors related to the pathogen is the number and concentration. Remember, the pathogen is that disease-causing organism, bacteria, viruses, parasites, right? Those are examples. Protozoa, those are fungi. Those are all examples of pathogens that can cause disease or illness in us. So these pathogens we look at how many of them there are, how concentrated they are, how strong or virulent they are, and how do they get in. We know that with COVID, for example, we know that COVID got out of our patients, right, through their mucous membranes, through the nose, through the mouth, through coughing and sneezing. So for us, we know that, okay, if I put a mask on that person, that's going to decrease the opportunity for that pathogen to get out and contaminate others. Okay. Environmental factors include the host's living conditions, okay, and exposure to hazardous substances. And for us as healthcare professionals, we use universal precautions or standard precautions. Anybody tell me what that means? Universal precautions? Okay, Manuel, what do you think universal precautions or standard precautions means?
May you repeat the question?
Yes, what do you think universal precautions or standard precautions means?
I think that they mean just precautionary measures that everybody in the medical field or anybody in general should use.
Okay, excellent. Well said. Give me an example.
A general precaution would be like no running at a swimming pool, something that helps all people invited.
Okay, so that's a good example of something universal that applies to all people. Okay, so that's not a bad one. Okay, and more specifically, in a healthcare setting, we're talking about gloves, we're talking about gowns. So whenever I'm going to come in contact with any patient's bodily fluids, I'm going to wear gloves, okay? It doesn't matter if they look like $1,000,000 or it doesn't matter if they look like they were sleeping in a sewer. I'm going to use the same precautions for every single one of my patients because guess what? You don't know who is infected, okay? So standard precautions, we're talking about gloves and our PPE, our personal protective equipment. Okay, so very good. All right, let's talk about asepsis. Okay, asepsis is another fancy word that you need to know. Okay, and so this is the condition in which pathogens are absent or controlled. We want to kill these microorganisms. Okay, it's important that we kill them. Now, when we talk about medical asepsis, we're talking about making it as clean as possible, right? Like hand washing, wiping things down with sanitizing wipes, those kinds of things. When we talk about surgical asepsis, we're eliminating any microorganisms. So that's what we're talking about sterilization using the autoclave. That's one of the things that we're going to be learning in the class when we do our hands-on, right? So if you've ever seen maybe in a movie or maybe you work in a healthcare setting, the blue field, the blue sheets and blankets that they have, that's a sterile field. In that sterile field, we don't have any microorganisms because we're getting ready to perform an invasive procedure on our patient, okay? So when we think about aseptic measures, we're thinking about keeping it as minimized as possible where there's minimum organisms or the total absence of organisms. And the absence of organisms is required for surgical asepsis, okay? So when we think about specific aseptic measures, we're going to talk about strict housekeeping standards, wiping down counters, table where the patient will lay, right? Examination tables, wiping those down in between patients, getting new paper on those tables, wiping down the equipment in between the use, wiping your stethoscope down, right? Between patients, all of those things. Educating patients about hygiene, health promotion, and disease prevention. These are all important things that we need to do. Now, we talked about hand washing, and those of you who missed the first day of class, that's okay. We did our hand washing. That was our first competency, but we will be able to do that again when we meet again. And we're going to do a bunch of competencies when we meet again. But hand washing. And some things that I mentioned is no jewelry, right? That includes your wristwatch, wedding band, that kind of thing. If you have an expensive, wonderful, nice ring, leave it at home when you're going to work. Don't say, oh, I'm going to wear it and then put it in my pocket. I've seen bad things happen. We can lose things out of our pocket, or we forget we have it in our pocket, and then we put our uniform in the washing machine and, in the dryer, and then boom, the ring is destroyed. So I would recommend not wearing any jewelry. You definitely are not allowed to wear nail polish and acrylic nails. Your nails should be no longer than 1/4 of an inch. How do I know? Look at the palm of your hand. If you can see the tips of your nails over the palm, when your palm is facing you, your nails are too long, okay? And think about the reason why. Evidence-based has shown that acrylic harbors bacteria and other pathogens. Also, the nail polish can chip off and fall into your sterile field. And if you have long nails, they can cut your gloves. So now when you're caring for a patient and there's bodily fluids because of your long nails, now your gloves are broken and you've become exposed and potentially contaminated. Okay, so really, really important. When you go for your internship, your last semester, you will not be allowed to go to your internship with your hair like Beyonce and with, fake nails and all of that. You really want to be professional. And we'll talk about uniform standards. And if you didn't get your uniform last class, that's okay. I'll have uniforms for you when we meet again. Anybody have any questions about the uniform? Okay, all right, so I was talking about hand washing. I don't see anything in the chat, so I'm going to keep going. All right, so we will do the hand washing again, but you're going to wet your hands. You're going to use 4 to 5 mLs of soap. You want to use warm water, not cold water or hot water. And you're going to lather. This is for 2 minutes. That's really, if it's 3 minutes, if you're scrubbing in, right? But if you're washing your hands, 20 to 30 seconds is going to be the norm, okay? You're going to keep your fingertips lower than your forearms, and so all the dirt will wash down your fingertips, okay? In class, we showed the little nail brush, and we showed the little plastic nail cleanser that you can use. Remember to get around your thumbs, to get your fingernails, and to get around your wrists as well. Don't touch the inside of the sink, and use a paper towel, a clean, dry paper towel to pat your hands dry, and then get a new clean, dry paper towel to turn off the faucets if it's not one that's controlled by your feet. The other thing that we talked about is alcohol-based hand disinfectants. You need to know the alcohol content is 60 to 95%, okay? 60 to 95% alcohol is required in order to kill any potential pathogens. Now, you have to wash your hands when they're visibly dirty or contaminated before and after eating and after using the bathroom, okay? Or if you've been exposed to any spore-forming bacteria. Okay, that's important. So factors that can affect the alcohol-based hand sanitizer is going to be the concentration of the alcohol and whether the hands were wet. When the product is applied, you don't want them to be wet, the contact time, and the amount used. So in the hospital setting, when I was a bedside nurse, they told us 3 times hand sanitizing. After that, you need to go find some soap and water and wash your hands. Now, I'm not saying that if there's no, if there's only hand sanitizer, if that's all you have, still use it. It's better than nothing. But try to wash your hands, after the third time using hand sanitizer. Okay. And then this talks about jewelry, alcohol-based sanitizer, and the length of the nails. Okay. And this shows the chipped nails. Okay. So that's the chain of infection. Anybody have any questions? All right. I don't see anything in the chat and nobody's unmuting. I'll give another moment to see if there's any questions. Okay. Lastly, I will mention blood-borne pathogens. So blood-borne pathogens could be found in blood, blood products, bodily tissues, human tissues, cultures, vaccines, right? Any used needles, any scalpels, any medical equipment that we use on the patient, and there's a potential for their bodily fluids to be contaminating it, okay? So gloves that have been used, disposable instruments, those are all potential for, infection. And those will be placed in the red bags, which are labeled biohazardous waste, okay? In this class, we won't be dealing with any biohazards, but in your medical procedures class, you will be, because you're going to be drawing blood, you're going to be taking each other's blood sugar. So then you will use those red bags that are in the back of the medical assisting lab, okay? All right, and that is the end. Any questions about this week 1? Okay. If there's no questions, we're going to jump into our game of Kahoot. The link is in the chat, and it consists of 10 questions, and it's on the information that we just talked about. Everything that's on this Kahoot is coming from week 1 of your notes. So go ahead and log in if you could, and we're going to take our chance to do this Kahoot, and then we're going to take our break. And on the break, I'm going to let you all take the quiz. So I'm going to give you a long enough break so you can take the quiz and come back and I'll have a chance to see it. Okay, but let's get our Kahoot. And those of you who are going to be the top 3, make sure you remember in case I forget, so you can get your prize on the next time we meet. Okay, let's see that. Yes, it is open note. So the Kahoot is open note and the quiz will be open notes also. So thank you for asking. And I think I might show this video beforehand, because the video will help if you're an auditory kind of learner. So I'll show the video before the actual quiz. Okay, but we'll play the Kahoot because that'll help me see how everybody's doing. But yes, this is an open note Kahoot and quiz. So I should have asked, or should have done a little bit more explaining about Kahoot. So if you go to www.kahoot.it, it's going to ask you for a PIN, and the PIN for this is 759467. If you're using your same device, you can click the link that is in the chat and you can log on. Now with Kahoot, this is a game of speed and accuracy, although it's for fun in this case. But when you look at my screen that I'm sharing, you're going to see the questions and you're going to see the answer choices, and they're going to be color coded. On your device, you're only going to see colors and shapes. So you'll have to make sure that once we start the Kahoot, you can see both my screen and your screen. A lot of times if you're using like For your Zoom, if you're using an iPad, you can use that. And then for the Kahoot, use your cell phone if you have those capabilities. If not, you can split your screen. Yes, my daughter is telling me to tell them they could split their screen because she could be because she is a Kahoot master, right? Erica, do you want to do this Kahoot? Oh, your Girl Scout meeting is starting in 7 minutes anyway. Okay, so make sure you're logged in. Okay, I don't see anybody logging in for Kahoot, though. I wonder why that is. Okay, is anybody having difficulties with Kahoot right now?
It says I'm logged in.
Oh, maybe I can't see it. All right, why is it not showing? Okay, Amaya said she's in. Okay, all right, let me see. Is anybody else logged in? Because I don't see anybody logged in. Okay, oh, wait, hold on at the bottom. Okay, oh, everybody is in. Okay, well, let's go. Sorry. I hope everybody's in. All right, Alt 130 infection control. Okay, perfect. Good luck, everyone. 10 questions. What type of infection is one that is required within the hospital or acquired within the hospital? Nosocomial, opportunistic, endogenous, or exogenous? Okay, you know what? If this was a quiz, I would give you credit for exogenous also. So, but nosocomial is what I was looking for. So nosocomial is a hospital-acquired infection, but it could be exogenous as well. Okay, endogenous is not correct. That is something that's harmless to us or beneficial, like the E. coli that we talked about in the example. It's not causing us any harm because it's in our intestines, but if we don't have proper hygiene practices, then we can have some problems. Okay, anybody having any technical issues with Kahoot right now? Okay, good. We're going to continue on. All right, so Samaya is in the lead. All right, here we go. Question number 2. What is the number one way to prevent the spread of infection? Wearing PPE, reusing gloves, wearing gloves, hand washing. What's the number one way to prevent the spread of infection? Wearing PPE. Okay, so it is hand washing. Okay, hand washing, hand washing, hand washing. If you were in class last time, we spent like 45 minutes talking about hand washing, right? A ridiculous amount of time, because that is the most important thing that we can do. And unfortunately, us as humans, we learned that lesson through COVID, but we still have to learn that lesson again. Oh, I'm sorry, Khadija, that happens sometimes. Okay, question 3. What does PPE stand for? Okay, pre-protective equipment, protective proper equipment, personal protective equipment, or none of the above. All right. Ooh, okay. So PPE is personal protective equipment. Okay, PPE, personal protective equipment. Okay. All right, Samaya is on fire. Okay, Amaya, okay, you got up there. Okay, Manuel dropped down a little bit, but that's okay. All right, let's go to question 4. Which one is not an example of PPE? Gloves, gown, mask, earrings. It's not an example of PPE. Gloves, gown, mask, earrings. Okay, everybody got that one. Okay, that was a good, easy one. Okay, fantastic. Speaking of earrings, don't wear dangly earrings when you're taking care of patients, because that is a hazard. If a patient's trying to grab at you, that could be, a safety issue. So, yeah. All right, Samaya, very good. 4 answers in a row. Question 5. What is known as a causative agent in the chain of infection? What causes it? Portal of entry, pathogen, reservoir, or portal of entry? Okay, so don't choose portal of entry. It's there twice. It's not right. What is known as the causative agent in the chain of infection? Okay, portal of entry, pathogen, reservoir, portal of entry. So it is the pathogen. The pathogen causes this infection. Okay, the pathogen is the causative agent. It causes us to become sick or ill. Okay, Amaya, you have a streak of 4. Way to go. Question 6. What means absence of pathogens? Sepsis, disinfectant, asepsis, or antiseptic? What means absence of pathogens? Okay, this was a tricky question. All right, let's see. All right, so good. Nobody chose sepsis. Sepsis is actually the state of the patient being infected. If a patient is septic, they usually have an infection in their bloodstream. So it's through their system. Disinfectant is when we wipe things down with disinfectants to remove the pathogens. Antiseptic is things that we can use on the skin. Okay, and asepsis is going to be the absence of pathogens, and that is misspelled. Sorry about that, folks. I didn't catch that till now. All right, Amaya, streak of 5. We're right up there with Samaya. Okay, good job. Question 7. What does OSHA stand for? Office Service Health Activities, Occupational Safety and Health Administration, none of the above, or Organized Safety Health Application. OSHA. OSHA. Yes, most of you got that one. That is good. So OSHA sets the guidelines and the standards to keep us safe as far as coming in contact with bloodborne pathogens, and using, certain protocols to dispose of biohazardous waste, right? At your jobs or your facilities, you may have an occupational health nurse that makes sure everybody gets their immunizations, their annual PPDs, right? So Occupational Safety and Health Administration, that's OSHA. All right. Okay, we're staying fast. And Amaya, you have a streak of 6. Way to go. Question 8. What is not a true statement about standard precautions? Treat all patients as if they were infectious. All bodily fluids are considered to be infectious. You may wash your gloves after each use and reuse them. Wear gloves anytime you come in contact with a patient, which is not a true statement about standard precautions. All right, perfect. Everybody got it. Somebody did not answer, but maybe you ran out of time. Okay, very good. Okay, try to get back in, Amani. The pin is at the bottom of the screen, 759467. I'm gonna pause for a second. So 759467. Okay, perfect. I'm glad you got back in. Okay, Samaya, you're coming back. I see you. Good job. All right. Diseases that originate outside of the body are known as endogenous, exogenous, opportunistic, or nosocomial. Diseases that originate outside of the body are known as exogenous. Think of exoskeleton, okay? Endogenous, those pathogens are actually already in the body, and the E. coli was the example that I used. Opportunistic infections or diseases, opportunistic infections strike people that have reduced or compromised immune systems, like someone that has lupus, somebody that is a cancer patient that is undergoing chemotherapy, or someone that has HIV/AIDS. Okay, those individuals are susceptible to opportunistic infections. Okay, and nosocomial is a health environment acquired infection. Okay. All right. Okay. So Samaya is still in the lead. Okay. Sophia, you're back in the game. Good job. What can be a reservoir in the chain of infection? Medical equipment, breaks in the skin, mode of transmission, or portal of entry? What can be a reservoir holding the infection? Okay, holding those pathogens. Medical equipment, breaks in the skin, mode of transmission, portal of entry. So it's actually the medical equipment can hold it. So that's why it's important to wipe down, sanitize the equipment, between each patient. So medical equipment, pens, and those things that can hold the pathogens are called fomites. Okay, fomites. Okay. So a pen could be a fomite. Your stethoscope could be a fomite if you don't properly sanitize it after being used on a patient. Okay. So medical equipment can be a reservoir, and medical equipment that is a reservoir is called a fomite. Okay, all right, let's see who's on the podium. I'm gonna write this down. So, all right, Sophia, nice job. Okay, Sophia in third place, Amaya in second, and Samaya in first place. Congratulations. Okay. So in the beginning of class, the next class when we meet in person, I'm gonna have a prize for you. Okay, very nice. Okay, let's see. I see the rest of the crew here. Fantastic. All right. So I stopped sharing my screen and let me try to get out of this. All right, while I'm trying to get out of this Kahoot, does anybody have any questions? All right, I have 6:04. That means we are due for our break, and we're also going to have our quiz. Okay, so the quiz is 10 questions. So I think if I give till 6:30, that should be enough time for you to take the quiz and take a break. So I'm sharing my screen because I want to show you how to get to the quiz. And before we go on break, I want to make sure everybody can access the quiz. You don't have to start the quiz right now. I'm going to give you till 6:30 and we'll reconvene at 6:30. But if you go to the Blackboard, go to course assessments, and you're going to go scroll down. You're going to see quiz number 1. You should click on quiz number 1 and then you launch assignment. Quiz number 1 has 10 questions, so I think it should take you about 10 minutes, but I'll give a little bit of extra time. And also take a 10-minute break. So we will reconvene again at 6:30. We're going to get into week 2. Okay, so we'll have those notes ready. Anybody have any questions? Okay, so it's up to you. You can take your break first. You can do your quiz first. It's up to you, and you are feel free to use your notes. Okay, I will start class again at 6:30. If you have any questions, you can unmute. If I step away, you can just put it in the chat, and I'll see it when I get back. But we'll see everybody again at 6:30. Thank you. Okay, welcome back, everybody. Thank you for taking a break and thank you for taking your quiz. Everybody did okay for the first quiz, so congratulations. Okay, anybody have any questions about the quiz? Actually, let's go ahead and review the quiz just to make sure that we're good to go. Okay, because not everybody got 100, so it's worth going over the quiz. All right, so I'm sharing my screen right now. We have 10 questions on the quiz. The first question says, the infection cycle begins when a pathogen is established in the reservoir host. Okay, so the infection cycle begins when a pathogen invades the reservoir host and begins to multiply. Any questions on number one? Oops. All right, I am sharing my screen, so you should see the quiz questions. Okay. Let me just make sure I have the chat up. Okay. We're gonna go. So great question. I'm gonna go over all 10 of them, and if you're still not sure which one you missed, then I can meet with you after class to see which one you missed. Okay, but we're gonna go over all 10 of the questions. Okay. Awesome. Anybody have any questions about number one? Okay, let's go to number two. Oh man, I meant to go over this one with you guys, but I didn't. Okay, so we didn't talk about this, I don't think. So I'm gonna give everybody credit for this one. Let me just write that down because I meant to mention that, and this might be the one. If you got a 90, this is probably the one that you. So how a congenital infection is contracted. Congenital means at the time of birth, they were born this way. That's what congenital infection means. So I owe everybody 2 points on. I'm pretty sure that's probably the one that people missed. So congenital means an infection that is present at the time of birth. Congenital. Okay. All right, I don't see any questions, so I'm going to continue. An individual into whom a pathogen has been transmitted and who has little or no immune to infection or immunity to infection by that organism is a susceptible host, right? They're the ones that's going to become sick. They're the ones that's going to become infected. Okay, so a susceptible host is a person whom a pathogen has been transmitted and have little or no immunity to that organism. So they will become sick. Okay, question 4. I don't see any questions in the chat, so I'm going to keep on going. Which type of infection is caused when a healthcare worker transfers staph bacteria from his hands to a surgical site? That is an exogenous infection. Exogenous infection. This is an infection that is caused by the introduction of a pathogen from outside of the body. Okay? Let's see. Exogenous infection. Very good. All right. The condition in which pathogens are absent or controlled is called asepsis. Asepsis is the condition in which pathogens are absent or controlled, such as through hand washing or through sterilization using the autoclave. Okay, so asepsis. I don't see any questions in the chat. I'm going to pause in case anybody has any questions on quiz questions 1 through 5. Okay, question 6. Which of the following is an example of direct transmission of a pathogen? So think of direct contact, and the answer is contact with blood of an infected person, right? Those good old blood-borne pathogens. So direct transmission occurs when the pathogen moves immediately from one host to another, such as through contact with the blood or saliva of an infected person. Any questions so far? Okay. All right, question 7. What type of infection is caused by a microorganism that is normally beneficial or harmless to humans? That will be an endogenous infection. So an endogenous infection is one in which an abnormality or malfunction in routine body processes has caused normally beneficial or harmless microorganisms to become pathogenic. Okay, so that is your endogenous infection. The example we keep using is that E. coli from our stool, right? Any questions so far? All right, question 8. The body's ability to resist pathogens and disease is called immunity. Immunity is the body's ability to resist these pathogens and disease. And a person that has little or no immunity, they will become, right, a susceptible host, or they can become a susceptible host. Okay. I don't see any questions. I'm going to move on. So a medical assistant can help break the cycle of infection or chain of infection in the office by maintaining strict housekeeping standards. That means by wiping things down, washing their hands, making sure we dispose of anything that's soiled, right? Those are all important things that we can do to break that cycle of infection. Strict housekeeping standards. Any questions? All right, last quiz question. Which of the following is most likely spread by airborne transmission? It's going to be influenza. So influenza, the tuberculosis, COVID-19, those are all spread through airborne. And in the case of a patient that has influenza, we're going to give them a mask so they can, kind of keep from spreading, right, their pathogens. Okay, the same with tuberculosis. And for us, we will wear an N95 particle mask. So if we are exposed to the patient's particles, our mask hopefully will protect us from getting those particles inside of our respiratory system. Okay, I'm going to stop sharing and I'm going to see if anybody has any questions about the quiz number 1. Okay, so I do owe everyone 10 points. I'm sorry about that congenital infection one, but now you will always remember that. Okay, I'm going to show a quick video. It's about a 5-minute video on the donning and doffing of personal protective equipment, the PPE. And let's get started. And if you have any questions or comments, please feel free to put them into the chat. Okay? And
I'm going to be demonstrating how to don and doff PPE. And that just means how to put on and take off my personal protective equipment. I'll be following the steps that we've included in our clinical nursing skills deck. So if you have the deck, go ahead and grab it and you can follow along with me. If you don't have the deck and you're interested in checking it out, head on over to leveluprn.com. Before I can apply PPE or personal protective equipment, I need to have already done hand hygiene, so I've done that. PPE always goes on in the same order. You may or may not use certain parts of it depending on what type of precaution your patient is on, but I'm going to demonstrate the full order in case we were using all parts today. So we start with the gown. So I'm going to go ahead and slip my arms in. Find my ties. And this, of course, should be done before you enter your patient's room. My patient's on any type of precautions, I need to be safe before I enter their space. I'm going to tie it in a bow. And then there's front ties as well to tie it around your waist. All right, next is my mask. So I'm going to go ahead and put my mask on. The blue side goes out if we're using these medical masks, and there's a metal piece in the nose to bend it over. I always want to make sure I pull it down to cover my chin. Next, I'm going to wear eye protection. And it's important to note that my glasses do not count as eye protection. I need to wear additional protection on top of my glasses. And the final step are my gloves. The gloves need to be pulled down so that they go over the cuff of the gown, so that at no point would any of my hand or wrist or forearm be exposed to anything. So that's how I don or put on my PPE. To remove my PPE, I start with my gloves.
Okay, let me just pause for a second. Does anybody have any questions about donning the PPE? Okay, so the order is important, okay, and the order that we doff is also important, okay?
Gloves. And this is really key to think about while I'm doing this. These are dirty. That's hard to remember sometimes in lab because usually you do what I just did, right? You put it on, you take it off, you put it on, you take it off. But in real life, I have touched something that's contaminated or been in a patient's room that's on precautions or whatever it is. So my hands are dirty. So I need to be careful when I take them off. I'm going to pull it by the lower cuff, not inside, and I'm gonna slip it off. I'm gonna roll it up. And then with this hand, I'm gonna slip it up under that and roll that off. And I'm gonna dispose of these. So I would throw those away. Next, I'm gonna remove my eyewear, and I wanna touch as far back as I can, right? The front of my face is contaminated and exposed, so I'm gonna touch way back here. I'm gonna remove my eyewear, and I would either discard of these, or a lot of facilities now have you clean them and reuse them. So I would at least set them aside. I'm going to remove my gown, so I'm going to pick it up by the cuff and slip it over. And then I'm going to do this one. Oh, I got to untie it first. Hang on a second. All right, I'm going to untie it first. So in real life, I often break them, but since I want to reuse my gown in lab, oh, I broke it. I'm going to break it anyway. All right, now I want to roll it down. Remove my hands. By touching the cuff, right? And that farthest part of the cuff was protected by my glove cuff, so that's safe to touch. And then I want to
It's something that you may see in a healthcare setting, and she's trying to reuse it, right? But in real life, we won't reuse it. We rip it and we roll it away from us, right? So we're not touching the outside that was potentially contaminated. So she's reusing it. You know, sometimes we reuse things when we're doing our demonstrations or teaching or in a classroom setting. But in real life, we're not going to reuse these gowns, and we're not going to reuse gloves, okay? Any questions so far?
touch it by the inside that was against me, and I can then dispose of that as well. Now the last step is the mask. And again, I'm going to pull it from the back ear loops, not from the front, from the back ear loops. I'm sure during this season you have seen lots of people move their masks up and down like this, and all they're doing is touching the contaminated part that you're not supposed to be in contact with. So I'm going to remove it from my ear loops, pull it straight away from my face, and dispose of that as well.
Okay, something you may have noticed as she's removing this gear, she's actually touching her hair. So that's why it's important for your hair to be back and up and away from your face, so you're not potentially contaminating your hair. So for those of you who have beautiful long hair, that's great, but you need to keep it up and back away from your face and up and off of your collar for this very reason. If you notice, she kept touching her hair, right? So now her hair is contaminated. And if you're contaminated in the middle of your shift, your hair, there's nothing that you can do, right? You just have to be that way until the end of your shift. Okay, so again, that's why the hair being up and back in a bun or a ponytail away from your face is really important.
And the reason why your mask is last is because you have to remove all of this inside the patient's room, right? You can't leave the patient's room with any of this on, or you're just bringing whatever that contamination is out into the general population. So I remove all the things that I can touch someone with or has been touched by someone, and then I remove my mask on my way out the door.
Now, I will say in real life, I wash my hands before I remove my mask, because once you take off your gloves, you take off your gown, your hands are still technically dirty, right? So I would wash my hands first and then remove my mask before I put my hands by my own face, okay? Now, this is like in a hospital setting, so you're going to have to see where you're working, because you might be in a hospital setting, you might be in an inpatient, outpatient kind of, scenario. But think about, if something is dirty, we don't want to contaminate ourselves. And I think that's going to be the biggest message, especially as we doff or take off this gear. Okay. Anybody have any questions? All right, so no questions. I don't see any questions so far. We are going to actually, let me take you to our first assignment, our first cognitive competency. So let me share my screen again so I can show you how to get to it. So everyone can do this at the same time, so that way we can all turn this assignment in tonight. That would be great. So I keep everybody on the same track. So I'm sharing my screen. You should see the Blackboard, and I want you to go under course assessments where you just were for your quiz. And you're going to see the tab that says cognitive competency drop boxes. This is where you're going to actually go to upload this competency once we are finished with it. But you're going to click this Alt 130 Cognitive Part 1. You're going to click that and it's going to give you a Word document. You're going to open that Word document and we're going to actually go over the answers to these 4 questions, because this is actually cognitive competency project part 1. But we're going to do this together to make sure everybody knows how to do these cognitive competencies. So I'm going to pause for a minute to make sure everybody has uploaded this document from Blackboard. So if you stepped away for a minute or if you weren't paying attention, go to your course assessments in Blackboard, scroll down, and I'm sorry, my daughter's having a Girl Scout meeting on Teams, so it keeps popping up on her computer. So that's why I keep getting those alerts. So sorry about that. But go to course assessments. You're going to go to cognitive competency drop boxes. You see that. You're going to click on Alt 130 Cognitive Part 1. And that will give you a Word document. And we're actually going to be going over this together. And then I'll show you how to submit it. I'm going to pause now so everybody has a chance to pull up this Word document. Okay, so if you are joining from a device where you can't pull this up, that's okay. Make sure that you are capturing the answers somehow. So when you do pull this up, you'll have the answers. It will make it easier for you to do this assignment. Okay? So that is fine. But this assignment will be due next week before we begin class. So hopefully this will help you get it done, since we're going to be going over the answers now. And again, it's okay if you are not by like a computer where you could type. I understand that. Take screenshots, do whatever you need to do, write down what's in the chat. So you will have the answers and you'll know how to do this assignment. Okay? Anybody have any questions about how to get to this point? Okay, and I should be sharing my screen. You should see this Word document here. Okay, so the first thing I'm going to definitely ask everybody to do is to type their name. Even though you are uploading this to Blackboard, it's helpful to me because once you submit it, I have to print these out and make a file for each of you. So I have a large class this time, so if I just have all of these assignments that are all the same, I don't know whose is who. So please put your name on the assignment, okay? So we're going to go through these, and I will be putting the answers in the chat to help you out. And also, if you have any input, you can as well put answers in the chat or unmute to give answers, okay? So this is project part 1. And something about the competencies, in order to pass the class, you must submit and get all of your competencies done. Even if you have 100 by tests and quizzes and you don't submit all of your competencies, you cannot pass this class. So that's why I like to do the competencies with the class to make sure everybody understands the information and everybody's able to turn it in, okay? So question number 1 is asking, what are the 5 major types of infectious agents, and give an example of each? Okay, so let me go ahead and help you all with that. So the 5 major types of infectious agents. Does anybody have any ideas or thoughts about that?
Is this referring to the like reservoir host and all of that, or is it something different?
So that's a great question. So this is referring to the types of infective agents, the pathogens, the different kinds of pathogens, like virus, bacteria, fungi, protozoas. So that's what we're referring to. Okay. So I'll start us out. So virus is one. Bacteria is another.
A fungus?
Yes, very good. Okay. Any others?
What about yeast?
So good, but the yeast is actually a type of fungus.
Okay.
So, but that's good. So actually you gave us that. So I'm going to put this here. Yeast. So that was a good one. So protozoa is an example, another example of a potential pathogen. And the last one is helminth. Okay, that's your parasite. Okay, so like your pinworms, if someone has pinworms, okay? So to help you all, I'm going to highlight this in red, okay? So what's an example of a virus?
COVID?
Yes, okay, very good. And you don't have to put the exact same things, right? This is just to kind of get you started, okay? HIV is another example of a virus, okay? So I think you'll get the idea there. So bacteria, what's some examples of bacteria?
Would strep throat be?
Yes, that is the Streptococcus aureus. Okay, actually that's Staphylococcus aureus, but yeah, so strep is one, very good. Anthrax is another. Very good. Okay, anthrax. So those are examples, and you don't have to use those examples. You can use your own. Okay. So for fungi, was already mentioned yeast. Ringworm is another example of a fungi. Okay. Protozoa. Think about these brain-eating amoebas. Okay. Oh, that's not spelled right. So your amoebas are an example of a protozoa. And then the helminth is your pinworm, right? Those intestinal parasites, okay? Pinworms. Okay, anybody have any questions about this first one? Hopefully everybody has this document. Oh, I'm sorry, I didn't see in the chat because I was typing. So yes, bacteria and protozoa. Yeah. Okay, great job, Amaya. Okay, very nice. Okay, I'm gonna pause here to see if anybody has any questions about number 1. Anybody having any technical issues trying to find this document? Okay, it seems like there's no questions in the chat. Okay, so we'll go to question number 2 then. Okay, so describe and provide an example of each phase of the infection cycle, including. Okay, so here we have the chain of infection, right? And when we think about the infectious agent or the infection agent, okay, what do we think of? And I'm going to see if anybody has put something in the chat. Yes, pathogen. Very good. Okay, that's a Maya. Excellent. So it's the pathogen. Okay, the microorganism that causes the infection. And I'm just highlighting the answers in red so you can see that. Okay, very good. So the infectious agent or the infection agent, that is the pathogen, what actually causes the infection. Okay, nice. Okay, and the reservoir. The reservoir. And you can totally get the answers for this from your notes. It's totally fine to get the answers from your notes. That's why your notes are there. Very good. I see you're sending me the messages. So the reservoir is someone who has an encounter with a specific pathogen. That is correct. Okay, great job. Okay. So the habitat in which the agent normally lives or grows and multiplies, and that is going to be, it could be a person, it could be equipment, food, water, animal, insect. Excellent. So that's what the reservoir is. Okay. And next we're looking for susceptible host. Okay, susceptible host. So I'm going to be going over all of these. So if you feel like, oh yeah, I want to give an answer, be ready because I'm just going in order. Okay, susceptible host. Okay, someone who has consumed the infection. Yes, I just love that. Okay, that is correct. Very good. So someone that they've taken it inside of their bodies some way, okay? And this susceptible host has a reduced immune system, okay? And I'm just giving a little bit of extra detail here, and you definitely put this in your own words, but I'm just trying to get you to understand the concepts because these are maybe new concepts to you. So the susceptible host is someone who has consumed the infection. I like that. That was put in the chat. So this person could be very vulnerable. Maybe they're the very young, like, babies, or the very old, like our geriatric patients, and they may have a compromised immune system, or they may be what we call immunocompromised. They may have medical devices that are going into their body that can actually put them at higher risk, right? So susceptible host. And if you're putting the answers in the chat, you're doing great. You're giving me all of that feedback. So that tells me that you understand these concepts. Okay, the means of transmission. What is the means of transmission?
The way a pathogen moves from one person or thing to another.
Yes, okay, excellent. All right, very nice. Okay, and I'm just going to put this there. So the way that infectious agent can be passed, and that could be through direct contact or indirect contact, ingestion or inhalation, right? We saw that it was ingestion from that contaminated glass of water. Okay, so very good. Okay, so if you're unmuting, if you're putting your answer in the chat, you're doing great. Something that has been contaminated, that's right. That's also correct. Okay, good job. That tells me that you understand the concepts, which is fantastic. All right, portals of entry is going to be the next one. Okay, portals of entry. Anybody have any idea what the portal of entry is?
The way the infection enters the host.
Yes, excellent. Okay, very good. And I think there's also in the chat, there's an answer too, where a pathogen can enter. Yes, excellent. Okay. All right, so, and I'm going to highlight that in red also. Okay, so the portal of entry, how does it get in? Is it getting in through broken skin? Is it getting in through a mucous membrane? Is it getting in when I eat something that's contaminated? Is it getting in sexually, right? Maybe the patient has something that's attached to them, like a Foley catheter or a chest tube. How is this infectious agent, this pathogen, getting inside of the patient? Okay. Any questions so far? All right, the portal of exit. Anybody want to say what that is? Okay, let's see. I think it's in the chat. Okay, I'm going to go to the chat. Okay, a place where there is an exit. Okay, so yes, how does it get out of the person that is the reservoir host? Okay, so that's very good. So how does that infectious agent leave? Okay, the reservoir. It could be through secretions, excretions, open wounds, aerosols, splatter of bodily fluids, coughing, sneezing, saliva, right? Urine, feces, right? All of those are different ways we can get the exit, right? So the urine will come from the urinary opening, the urinary meatus, feces coming from the anus, right? And all of these other potential ways it can exit. Okay, I'm going to just put number 2 in one shot so you could see it, if those of you that are taking a screenshot. Um, Anybody have any questions on question number 2? Okay, I don't see anything in the chat. I'm just going to pause for another moment for those of you who are taking screenshots, so you can capture this if you're not able to type it as we go. Okay, anybody have any questions? All right, well, I'm going to continue on. And this one is a good one. These things that are listed on the asepsis list, we're going to identify the following as practice within an ambulatory care center by matching the asepsis practice with each of the items below. So is it medical asepsis or surgical asepsis? Remember, surgical asepsis is going to be more strict. It's going to be more clean because we are invading the patient's body cavity. So anything that is invading a patient's body cavity, more than likely, we're going to use surgical asepsis. Okay, so that's meaning we're sterilizing the equipment. We're setting up those blue sheets with our sterile field. Medical asepsis is still clean, but it's not sterilized. Okay, so let's take a look at these different things. And I'll walk you through the first couple. I think there's an and, let's see, hand washing versus scrubbing. So that's right. That's correct, right? So hand washing would be medical asepsis, but surgical asepsis, I would scrub in for a full 3 minutes from the elbows all the way to the fingertips. Okay, so very nice. Okay, I like the way you're thinking. Okay, so let's look at administering oral medication. Am I going to scrub in for 3 minutes if I'm going to administer oral medication? No. So that is medical asepsis. Okay, that is considered medical asepsis. I will wash my hands and I will put on gloves, but they're not sterile gloves. So oral medication, that is medical asepsis. Okay, I'm not scrubbing in. Okay. So, so very good if you put that in the chat. Okay, let's go to the next one. Inserting sutures. What do you think? Is that medical asepsis or surgical asepsis? Inserting sutures. Are we doing an invasive procedure?
Surgical?
Yes, that is correct. It is surgical. Nicely done. Okay, it is surgical because we are breaking the patient's skin, right? Well, and technically we're helping to repair the break in the skin. Usually people get sutures because they have an incision or they have a wound that we're trying to get the skin to come back together, the edges of that wound so they can heal. Okay, very good. Hopefully this is starting to make sense. Um, let's take a look at the next one. Taking an oral temperature, is that medical asepsis or surgical asepsis?
Medical?
It is medical, right? Because yes, I wash my hands, I put on gloves, but I'm not scrubbing in for that. Okay, so 3 is oral temperature is medical asepsis. Okay, what about applying an elastic bandage to the forearm? Is that medical or is that surgical?
I'm gonna say medical.
Medical. Yes, so it is medical, right? I'm not scrubbing in if I'm just putting on an ace bandage. Okay, so it is medical. Okay, very good. And I see you putting your answers in the chat, so that's great. So keep it up. That is fantastic. Okay, see here. The next one is a needle biopsy. And if you're not sure what a biopsy is, we are actually taking a long needle and we're removing tissues and fluid from the patient. So we are
Surgical.
penetrating. So that's right. It is surgical. It is surgical. Okay. And removing a sebaceous cyst. Okay, so anybody want to guess what that is? And a cyst is just a growth. Sebaceous cyst is like, it's like a pimple. It actually is a pimple. So if we remove that, is that medical or surgical?
Is it surgical? Don't you have to break the skin?
It is surgical, and the importance is we don't want to introduce any infection, right? Because if we, use something dirty to remove this sebaceous cyst, now we have contaminated the patient. Okay, so very good. All right, obtaining a pap smear, is that medical or surgical?
Surgical.
So at first I thought it was surgical too, but this is actually a medical kind of scenario, right? So what happens is we do set up the sterile field, but we are not, well, actually, I take that back. Let me think about this for a second.
Yeah, that's hard because they be all in your business on that.
I know that's hard. So you do set up a sterile field, but the doctor doesn't necessarily use sterile gloves.
Yeah.
That's the thing. This is always tough when I think about it. But the pap smear, the equipment is sterilized if they're reusing the speculum, because sometimes they have the titanium speculum that they reuse, um, or they have the disposable ones. So I would, you know what? I would say that if it was a Foley catheter, then that's definitely surgical. But the pap smear is, I would say, medical.
Okay.
Medical. Although I would still be concerned of introducing, infection to the patient, but it's usually medical. The Foley catheter, that's going to be surgical. Okay, let me see. That's going to be surgical. Because the thing is, believe it or not, because in the vagina, there's actually a normal bacterial flora that lives there. So there's
Mhm.
normal, organisms that live in the vagina. However, for the urinary system, that is actually a sterile system. So there's no organisms that live there. There shouldn't be, right? That's how, if there are organisms that are living there, that patient probably has, the UTI. So it is a sterile kind of procedure when I'm inserting a Foley catheter in a patient. Okay. I know that's kind of unusual, like, but they're right next to each other. It's amazing how the body works in that way. Okay. Now, if I'm getting an IUD or if the patient is getting an IUD, what kind of condition is that? Is that surgical asepsis or medical asepsis?
Is
And
surgical?
it is surgical, so this has to be surgically placed, and this is a very invasive procedure because an intrauterine device is a method of birth control where they're going in and they're putting in a device to block sperm from being able to enter through the cervix and go up into the fallopian tubes to prevent pregnancy. That's the whole idea of this. And so the IUDs stay in place for, an extended period of time. So this is a surgical kind of asepsis that we need to make sure because you don't want the patient to become infected because we're going into the cervix. We're going beyond the vagina here. Okay. So it is surgical. And then let me try to make this one page. So when we take a picture, all right. And then lastly, applying a dressing to an open wound. Is that surgical or medical asepsis?
It's an open wound, so wouldn't it be surgical?
It would be. Okay, excellent. Okay. Okay, Amaya says, okay, a medical procedure. Okay, for the pap smear. I think that's what she was referring to. Yeah, I always don't like that answer, but I think that's right. I always hesitate when I see the pap smear, but yeah, and it's medical. Okay, and we did put medical. I think that's what you're referring to, Amaya. I like your style. I like the fact that you're researching it. That's a good way to be because if there's any ever a question, it's okay to look things up, right? And it's okay to say, hey, you know what? Can we double check that? I'm not sure if it's right because you're going to be the kind of medical assistant that says, you know what? Let me ask the doctor about that. Let me just get some clarification. And I think that that's a really good way to keep your patients safe. Okay, so that's wonderful. And guess what? Everybody makes mistakes. Your teacher may make a mistake. Your nurse may make a mistake. Your doctor may make a mistake. Everybody makes mistakes, but all of us should be working to keep the patient safe. Okay, so hopefully no one will ever take it personal if they make a mistake and you let them know in a tactful way, right? What about this? Or I have questions about this, or can I get clarification? That's a good thing to do to keep your patient safe. Okay. I think that's all of the different things. Okay. So anybody have any questions about the asepsis list? And if you're taking a screenshot, this is a good time to do it. Okay. All right. We're going to go on. And I think this is the last question. Yes, this is the last question. Good. All right. So identify personal protective equipment by listing the PPE for each of the following. So I'm going to tell you all of the PPE is going to be the same for all of these, okay? And we think about universal precautions, standard precautions. That's the question that Manuel answered for us. So when we think about these precautions, what would be the PPE? You can unmute or you can say it or put it
Glove?
in the chat. Yes, gloves. Very good, Khadijah. You got it. Anything else? What are some other forms of PPE? That's right. Amaya says eyewear. Okay, very good. Gown. That's right.
What about masks? Like
Yes,
masks?
mask. Both of you said it at the same time. She said it in the chat and you unmuted. So yes, all of that is potentially something that you could wear. And I would wear the goggles if there's a potential that there's going to be splashing, right, of bodily fluids. Okay. For example, if you're working with a combative patient, I've had a patient before one time threw his urinal full of urine at me, right? So yes, and I know that, okay, this patient has a history of that. I'm going to be all gowned up before I go into that room, right, in a hospital setting. Okay. So yes, personal protective equipment, PPE. That's right. So all you said it, Amaya, Emily, I see you. Very good. A regular paper mask and the mask that covers the whole face. So that's a great question. So we saw in the video, she had a blue mask that was just kind of a face mask covering the nose and the mouth. But there is a shield that we can wear that protects your eyes, your nose, and your mouth. There's also the N95 mask that has the filter, and that's a specific kind of mask because it protects against smaller particles like with tuberculosis or COVID. Okay. So I know with COVID, everybody was getting all of these different kinds of masks, but we really want to wear the hospital grade masks. There was a mask shortage with COVID, so that's why, like, any mask we could get, was better than nothing. But really, you want to use the hospital grade masks, which are usually the blue and the white is on the inside. The blue goes on the outside, and the white goes facing the person. Okay, does that answer your question about, okay. And again, if it's something airborne like tuberculosis or COVID, the healthcare professional will wear what's called an N95 mask. And it actually has a filter on it to prevent those tiny particles that can get through the regular blue mask. They can get through it. They would not be able to get through the N95 mask. Okay. All right, so hopefully, and I'm going to pause for a minute so everybody can take a picture if you need to, if you're not able to complete it this time, but this is going to be the last question because now I'm going to show you how to upload this into Blackboard. Anybody has any questions? All right, once you are done and you have saved your document, and I recommend that you save it in a place that you will always have it. And maybe you should make a file for all of your, MA work by class, make a folder. Okay, this is all of the assignments I've done for all 130. Because sometimes I find that students do the assignments and then they lose it, right? Which is unfortunate. And I would say if you're backing it up to your computer, back it up to maybe a cloud or something else, or maybe even email it to yourself, because I've had students that their computer dies and then they lost everything that they had on the computer. So think about how you can, back it up to save it so it won't be lost forever. All right, so once you are done with this, you will go to under course assessments. You'll go to Blackboard and you'll go to cognitive competency drop boxes. You will click that black link and you will go to part 1, cognitive competency. You will click part 1, cognitive competency, and then you will upload files because you're going to save that document as a Word document. So you're going to upload your file and you're going to browse for your local file. You're going to attach it and then you're going to submit it. Once I see it, I will be able to read it. I will be able to print it out and include it in your manila folder that I have for each of you for this class. I'm going to pause now. We'll see if anybody has any questions about how to submit it. Okay. I don't see anybody having any questions, so I'm going to pause for a second while you do submit it because I just want to make sure that you're able to submit it. If you have questions on how to submit it, please ask now. Okay, I'm no longer sharing my screen. Let's see. And okay, all right, sweet. I see 2 people have already submitted it, so that tells me that, okay, the instructions were clear, that everybody's able to submit it. Okay, everybody have any questions over what we've gone over so far tonight? Okay. Let me just see here. I see, and I thank you because most of you have done all of the assignments from Module 1. So that is very, very helpful. Okay, very, very helpful. Make sure if you haven't done Module 1 assignments, please do Module 1 assignments. I do want to introduce Module 2 just for a few minutes before we dismiss class, just to make sure that will kind of help you get started on Module 2, because Module 2 assignments will be due next time, okay? So I'm sharing my screen, and these are the notes for week 2. Anybody have any questions? Oh, wait, am I screen sharing? Let me just make sure. Okay, yes. All right. Anybody have any questions about how to get to week 2's notes? Okay, fantastic. All right, so I'm just going to give a quick overview, and when we meet again in class, we will. Okay, so it won't allow you to download. Okay, so yeah, that's okay if you send it to my email. When we're in person, I can help you walk through it. Okay, so thank you for letting me know. Okay, yes, but it's important that you say what you've got. Okay, so we're just going to quickly do a quick general overview of this particular week 2. When we meet again in person, hopefully, prayerfully on next Wednesday in person, we're going to pick up with our lecture for this week. We'll probably take a quiz, and we're going to spend the bulk of the time doing some competencies, some hands-on for vital signs. Okay, that's going to be the big thing next week. Some of you have to make up the hand washing. We'll do that, and we'll get you through vital signs. I will post a video on vital signs if you want to kind of get a jump start. If you're a little concerned about the vital signs, I will share that afterwards. I'll send a wrap-up email, but expect next time to come in uniform. And if you don't have a uniform, I'll get you uniform. But we'll go over Module 2, and we'll spend the time doing vital signs, height and weight, and some hands-on activities. Okay, and again, Modules 1 and Modules 2, start working on that. If you happen to see a 0 in the grade book, you still have the opportunity to make that up. I just put the zeros to keep me on track so I don't get behind with my grade book. And it reminds you and it reminds me that, hey, you need to do a particular assignment. Okay, so for the 2 new students, I didn't put any zeros because I know you just got into this class. So I'll give you until next week to try to kind of get caught up. Okay. And usually for the new students, after class, I put a summary of what we've done, and I put videos that may be helpful, and I put what we're going to do next time. So reading your email daily is going to be helpful. Okay, so week 2, we're going to be talking about charting. That's documentation. If you don't document, it didn't exist. And we want to think about when we are charting, we're using the client's words, what they say, we put it in quotes. We want to be clear. We want it to be complete, concise. We want things to be in chronological order, and we want to keep things confidential. Okay, and this is just a quick kind of overview. Okay, we'll go into more details in class next time. HIPAA, that's really important, right? We hear HIPAA violations. We don't want to have HIPAA violations. Health Insurance Portability and Accountability Act. So if we reveal information about a patient, right, to someone that doesn't have the need to know, that could be a lawsuit for our facility, okay? And it could be jail time. Okay, so we really want to make sure that we have permission to disclose information. Okay. When we are working with our patients, we should be active listeners. So we should be maintaining eye contact. We shouldn't be looking at our cell phones. You shouldn't really have your cell phone in a patient care area anyway. You should use open-ended questions. You should make sure that when you're interviewing the patient, it's a place that's private, free from interruptions. We want to deal with sensitive topics with respect. We're not going to laugh if the patient says, "Oh, I have a rash or it burns when I pee." That's not the time to laugh, okay? So we really want to be very respectful as our patients share these things with us. And you want to document as soon as possible. You don't want to wait till the end of the shift, and that's called due course. So we also want to have good body language, open body language, and the patient's reason for being in our facility is called the chief complaint. It's not that the patient is complaining, but that's what it's called. The reason why they're in the office today. Maybe they have a rash. Maybe they have a series of headaches. Maybe they feel like they have a cold, right? Or they have COVID. The chief complaint, why is the patient there? We're also going to get into taking vital signs. That includes blood pressure, their heart rate, their respiratory rate, as well as their temperature. If a patient has a fever, that is said to be febrile. If they don't have a temperature, right, meaning that their body temperature is in normal range, they're afebrile. A is without. So febrile, they have a fever. Afebrile, they don't have a fever. If the patient has exceptionally high fever, we're talking about 102, 103, this is hyperpyrexia. Now, this could be life-threatening. If the patient could have seizures because of that high temperature. So this is pretty serious and concerning, okay? And usually fevers are a sign of infection. When we use a thermometer, you can use it in different places. There is a specific thermometer that's called a rectal thermometer. It usually has red somewhere on it. Only use that in the patient's rectum. Never use a rectal thermometer in a patient's mouth, okay? Even if you use a plastic covering, like that's really huge, okay? We can take oral temps, tympanic temperature in the ear, rectal temperatures in the armpit, that's the axillary temp, and temporal is at the temple, okay? The normal temperature is 98.6 degrees Fahrenheit, and we're going to go over this again in class. Pulse and respiration. Pulse is your heart beating. Respiration is how many breaths per minute. We're going to learn how to take those. The normal pulse for an adult is 60 to 80 beats per minute. That's the heart beating. A normal respiration is 12 to 20. We're going to be able to feel the pulses of our patients, and we're also going to understand that breathing is a process where we inhale and we exhale, right? So that's inspiration and expiration. We're also going to learn how to use a stethoscope next class. So we'll talk about that next class. We'll talk about the normal blood pressure, which is 120/80. And we'll talk about high blood pressure, which is hypertension, and low blood pressure, which is hypotension. And sometimes your patient can actually have changes in their blood pressure when they go from lying to sitting to standing. And that is postural or orthostatic hypotension, okay? We'll talk about the pulse points. We'll also hopefully have a chance to do the eye exam, which is using the Snellen chart, okay? That's if you have glasses, you know what the Snellen chart looks like. It has all the alphabets. They have a really big E at the top of it. So we'll do that. And we'll also talk about the test for color blindness, which is the Ishihara color test, okay? And I think that's the end. All right, so that was a kind of a quick overview of what we will be discussing in a little bit more detail next class. Expect to have a quiz on that after we review, and expect to do a lot of hands-on. And I will post videos of examples of us walking through those particular kinds of procedures. Okay, so that's a great question. Which temperature method do I recommend that's best? It depends. For a child, or I should say for an infant, they can't hold the thermometer under their tongue. So best is going to be axillary. But if I feel like they have a fever, then, and it's really, I'm concerned about high fever, rectal temp would be best for that infant. So it depends on what's going on with the patient. For example, if I have a patient that their jaw is wired shut, I won't be able to take an oral temp. I might have to take an axillary temp. Now, here's a warning. If a patient has rectal bleeding, blood is coming out of their anus, we never want to get a rectal temp, okay? What you usually find is an oral temp under the tongue. And for children that are able to hold the thermometer under their tongue, that's fine. Sometimes your young children, we might have to hold it, the thermometer under their tongue for them, and they have to be still, okay? So that would be like maybe your kindergartners, your 5-year-olds. We might have to hold it for them, but as they're older, they should be able to hold that thermometer under their tongue, okay? So hopefully that answers your question about which temp method do you recommend. And okay. What do you mean by NCLEX? There's a question about NCLEX. I'm not sure what that means. So for MAs, you don't take NCLEX, you take the Certified Medical Assistant examination. So that's the test that you take, and you will need this information for that exam if that's what you're asking. I'm not 100% sure, but I'm going to stick around after class to see if you have any other questions. Okay, I'm going to stop recording.